to those as well.
Lebu, thanks very much for getting us up to date. Let's get more now on the logistics of rolling out the vaccine across the US. I'm joined from Pittsburgh in Pennsylvania by Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security. Thank you for joining us here on BBC World News. We're hearing there about the hope for vaccinations to be given from Sunday or Monday. How long do you think before herd immunity can be reached by means of delivering vaccines?
To reach that herd immunity threshold is going to take some time. Likely in the spring of 2021, early summer of 2021 is when we'll get above maybe 70% of the eligible population vaccinated. The aim with this early rollout of the vaccine is not necessarily herd immunity. It's to protect vulnerable populations who are right now in our hospitals, causing hospitals to worry about their capacity on a daily basis. So that's what we're trying to do initially with this vaccine, is keep those vulnerable populations from needing hospitalization.
And do hospitals and medical clinics have the PPE, have the freezers, have the PPE, have the syringes, the kit that they need to deliver vaccinations?
This has been starting to be rolled out right now. Operation Warp Speed has been sending these kits to hospitals. Not every hospital has the deep freezers. Some of them do, some of them don't. And there is going to be support, hopefully, at the state and local health department level to have this type of refrigeration available for hospitals who can't purchase these refrigerators. There are major companies, for example, UPS, which have made freezer farms in Kentucky in order to kind of make sure this cold chain stays intact. But it is going to be very, very challenging, and I'm sure there's going to be hiccups. But I think we can do this if everybody works diligently. And I guess this is one of the benefits of Operation Warp Speed. That this has been planning for some months now.
Operation Warp Speed is operating, I suppose, at a federal level. But as you've noted, a lot's going to depend on what's rolled out state by state. Is this going to be a matter of which states have the infrastructure?
Definitely. And we've been advocating that Operation Warp Speed, the federal government, make sure that states are well resourced, that they're funded adequately to be able to do this last mile before the vaccine gets into the arms of Americans. That's going to be very crucial, because it's one thing to get the vaccine to a state, but much harder to then get it into people's arms and turn a vaccine into a vaccination. And that's where we're really worried. It may vary from state to state. And like I said, it's not going to go off without a hitch, but hopefully they've planned for all contingencies.
Here in the UK, we've just started rolling out the Pfizer jab, but there have been a couple of adverse reactions in the early vaccinations. What do you do in terms of monitoring reactions, side effects, with a view to reassuring the public that they are safe?
So what we will do is, after someone gets a vaccination, they'll be kept there for a period of maybe 15 to 20 minutes to make sure there's not an immediate reaction. And we are also going to keep track of those individuals who get vaccinated. And there's going to be a way for them to report their side effects, to check in, so that we can get a lot of data to understand what the full safety picture is. Because we know that when we move from a phase 3 clinical trial with tens of thousands of people to vaccinating hundreds of millions of people, or even billions of people, if you think about the world, we will start to see rare side effects become an issue, because if something happens 1 in a million, you're not going to see it in a 40,000 person clinical trial. But when you vaccinate 100 million people, you will start to see cases. So this is going to be important, and we need to be transparent and really communicating with the world's population and the American population about this proactively, so that we can encourage people to get this vaccine and tell them what the risks and the benefits are, so that they can make informed choices, and hopefully they will get this vaccine.
I think you've given us a lot of useful information. Amish, thank you very much.